Okay, thank you very much. Good morning, everyone. We recognize our very senior colleagues and senior colleagues present on this meeting today. Welcome to another edition of our fortnight's webinar. Today we have Dr. Chima Edoga from Enugu State University Teaching Hospital, Park Lane, who's going to be taking us through the role of smartphone fundoscopy in ophthalmology. We all know that digital fundus photography or even the art of fundoscopy is something that is quite important in the care of our patients. And there are also challenges that have been associated with the technology. So Dr. Edoga is here today. Will share his experience because he's done a lot of work on smartphone fundoscopy that I'm very well aware of. And he's going to be sharing his experience, the challenges, how to go about it, how to be adept at such a skill. So without wasting much time, I welcome Dr. Chima Edoga. The floor is yours.
Okay, so I want to share my slides now. Can you see my screen?
Yes, we can see your screen.
Is it on presentation mode or is still on? It's full screen, right?
It's a full screen, yes.
Okay, all right, all right. Good morning, um, our teachers here present, mentors, elders, senior colleagues, and colleagues. I'm highly honored to be with us this morning to discuss on a topic that is very dear to me, which is smartphone endoscopy. Um, I pleaded with the rep of YOF that contacted me. We are going to have this series in two parts. First part, we are going to build some theoretical foundation, and the second one, we are going to do demonstration. So I will try to do a live demo in the next lecture, which I will label part two. So because some people have indicated difficulty, you know, they say that the learning curve is steep. So I will discuss the tips on how to have very good images with smartphones. So you can see on this first slide, the pictures on top left, top right, and then pictures on the bottom left, we are all taken by smartphone. So you can see how clear these images are. So if I should, let me on my pointer. So you could see the cup, you could see the rim that is pink, you could see the fovea light reflex. You can even see this reflex here. Then this picture was taken from this picture. So you can see that this view is more than 50 degrees view. You can see the optic disc, nasal to the optic disc. You can see the macula, temporal to the macula. So smartphone fundoscopy has really gone to some length. If you come down and look, this is a side-by-side picture of a patient that had a a, um, a traditional tabletop fundus photograph and with smartphone. You know, if this smartphone was sent to a retinal surgeon and then this one is sent, likelihood that a surgeon will make the same diagnosis is very high. So it's quite striking. So I want to appreciate the roles that these people have played in the development of this technique. I want to especially thank Professor SNN Wosu, and then especially Professor Oluleye. It was in 2017 that he taught us a technique. That time he was in an iPhone 5, and I took interest in it. So from 2017, I made my first presentation in 2018 in Abuja, and every other OSN have also been invited for this same topic. I want to especially thank Professor Popola and the others for their encouragement. So in terms of nomenclature, there are different names for smartphone fundoscopy. So like you can have smartphone fundus photography, smartphone retinal photography, retinal imaging, retinal imager, smartphone assisted indirect fundoscopy or ophthalmoscopy, and smartphone based fundus camera. So these are the different names that you may meet in literature. So this is the outline I'm going to use for the first part. I'm going to talk on introduction, principles of smartphone fundus photography, the lenses and the adapters for smartphone fundus photography, and mobile applications for smartphone fundus photography, then uses of smartphone fundus photography, safety, sample fundus photography. Because of time, I'm going to, because we just have barely 1 hour for this discussion, I'm going to major on the principles, I'll major on the lenses, and then while I'm discussing some of the samples, I will now touch on the mobile applications, the uses, and then the safety. But I'm going to make this presentation available and it will be more detailed. So the part two portion of it, which uh, I'm going to be taking in 2 weeks' time, I'm going to be discussing artificial intelligence and smartphone fundus photography, then the tips and tricks to improve quality of fundus image and reducing the difficulty in acquiring the image, and then reducing the time also, time of acquisition. So I'm going to be sharing some of the experiences I've had over the past couple of years. Then we'll do a practical live demonstration. Then most importantly, I'll share some of the sources of the materials and the application for this technique. The sources, some of them are locally available, while some of them you may need to order it from outside the country. Then I'll take questions and answers. In terms of introduction, the first mention of smartphone fundoscopy in literature was by Lord et al. In 2010, and he had a simple method. He wanted to bring in smartphone to know what it will be like if you use a plus 20D diopter lens, a pen touch, and a smartphone. So he didn't use the camera flash of the smartphone. He just used the pen touch. So he was able to see the image of the retina on the smartphone using the illumination from the touch. So that was the beginning of smartphone fundoscopy, and it has been an area that has gathered a lot of interest. If you just do a search, a literature search of smartphone fundus photography, or fundoscopy, you will see that a lot of research has been done, even as recent as 2024. So it's an area that has a lot of interest because of the advantages of smartphone, in the being commonly available, having sophisticated camera systems, having the ability to capture the image for transmission to someone outside the place that the image was captured for interpretation. It has its role in teleophthalmology. It does not require electricity. It's relatively cheaper when you compare it to the cost of traditional standard fundus camera system. So I believe that's why it has been increasing in interest. Then later, they started using the camera flash instead of using the external flashlight, and then using the autofocus system of the smartphone. Then the camera flash is LED, which is light emitting diode, and most of the phones use this LED for illumination. And one important thing here is that it's a coaxial illumination. So if you want to check whether your phone can actually be good for fundus photography, it has to be coaxial. So by coaxial, I mean that the positioning of the flashlight to the positioning of the camera, the main camera, should be within 1 cm to each other. And they should be side by side, preferably horizontally instead of vertically. Because if you check some mobile phones that we have, the positioning of the cameras and the flash usually vary because they are usually made to take pictures of people that are facing you. They are not actually made for funded photography. However, through my little experience, I've found out that iPhones usually have the best um, outputs in the sense that they have coaxial camera, especially from iPhone 8 down to iPhone 7, iPhone 6, and iPhone 5. But what I would recommend straight up is iPhone 7 or iPhone 8. I'll discuss it later, actually in part two, when I'll be discussing some of the tips and tricks that's involved in smartphone fundoscopy. Then it's actually complex if we are starting, but it's very easy to master. Last OSN, we had like around 7, 8, or 9 participants in the smartphone fundoscopy session. And after a 1 hour theoretical presentation, and we had about 30 minutes live demonstration, we were able to get the attendants to take very good quality retina image with my setup. I was not touching them, they were the ones that were taking it. So I'll also show you the pictures that they were able to take. So these are some of the people that have done some work in smartphone from this photography. You can see our own Professor Ule and Professor Kukola. They are one of the ophthalmologists that have made considerable contributions in this area of smartphone from this photography. Then you also have um, some adapters which I'm going to mention, and some applications which I'm going to mention. Of particular importance is this Woman Indirect. Woman Indirect is an app that was developed by an ophthalmologist who is, when he developed it, he was a resident. He was based in Atlanta, Georgetown, Atlanta. In the second year, that was when he started doing this, and he has continued. The last time I checked the App Store, he has so many apps. So I'm also going to talk a little bit more in the part two of our presentation. So in terms of the optics, it's very important for us to understand some of the things that are involved in getting very good images. So these are, for the optics, you have 5 things. For the mobile applications, you have 2 things in addition to the skill that you develop, but these are going to help you. So the choice of the condensing lens is also important. The most widely used condensing lens is plus 20D, but you can use plus 15, you can use plus 22, you can use plus 25, you can use plus 28, you can use plus 30, you can use plus 40. You can also use some hybrid lenses like Retina 2.2 or digital clear lens, which are made by Vogue, Vogue. So these are the lenses. And then the other thing that you need to also look at is the lens eye distance. This is distance between the lens and the eye or the cornea. So this distance is what you alter to get a sharp image of the retina, which is formed on the posterior focal point of the lens, of the condensing lens. So it's an inverted image that is formed. And that aerial inverted image is what is captured by the camera of the smartphone. So this distance is distance that you need to look at, and you shouldn't be moving, making wide movements for this distance. The other distance you consider is a lens phone distance. So this comes the freehand technique versus the adapter considerations. So, like I mentioned, Lord et al. And some of the earlier researchers in this field, they use the freehand technique, and freehand technique is usually very difficult to master, even though you can still master it. But I found it difficult to master, so I now had to go to find out what are the options for the adapter. How can I fix this lens phone distance so that I will only worry about the lens eye distance? Because if you fix the lens phone distance, because for you to have a good image, you need to align the center of the pupil to the center of the condensing lens to the center of the camera for you to have a good image. So it's like a straight line that runs through the center of the camera, the center of the lens, and the center of the pupil. So imagine if you are battling with the lens eye distance, which if you alter it, you are going to alter this alignment. Then you're also battling with the lens phone distance. So if you battle with those things, you can imagine how your um your lines, your light ray lines, are going to be like, they will not be straight again. So, and that will impact, that will bring aberrations to the image and distortions, and you not get a clear image. Then the other one is the smartphone camera optics and coaxial illumination. I've also already mentioned about this coaxial illumination. Then for the smartphone optics, this is where the smartphone um, type comes in. Some have used Samsung, some have used other phones like Techno, Huawei, iPhone, but iPhone seems to be one of the best. And if you want to use this as a tool in your clinic or in your practice to image the retina, I would advise to get an iPhone. And iPhones of lower years actually very affordable to get. You can get an iPhone 7 or 8, for instance, at about 100,000, just slightly above 100,000. Unlike the more expensive iPhones that are approaching 1 million, and they will really serve you. If you can get the one that has a relatively large memory, at least up to 128 or 264 gigabytes, so that you could store some videos and pictures before the camera gets filled up, because that is one of the challenges of iPhone. But in the part two, I'm also going to share with us an app that you can install on your laptop. It will be easy for you to obtain the images from the iPhone and store it either in the cloud or in your phone, in your laptop memory, your PC memory. The next one is the capturing apps. So I also discovered that the people that described the first cases, they use the native camera app of the mobile phone, as every phone comes with a camera app. But I noticed that there are lots of issues with that, because you are going to be battling with the intensity of the illumination coming from the LED of the camera flash. And two, you are going to be battling with focus, which in most cases you need to be tapping the screen to be able to get a focus. And three, you are going to be battling with exposure. For instance, if you want to image the optic disc and you have high exposure numbers, the optic disc will be overexposed and you will not see details. For instance, if you are looking at getting the vertical curve disc ratio, if you are looking at getting, let's say, disc hyperemia or new vessels on the disc, you may miss it out. So the native camera app fails. So what I found that you have some special apps that can alter the intensity of the illumination. You can alter the focus. Either you do manual focus or you do autofocus. So it does the autofocus for you automatically. Then you can also alter the exposure, which is very critical. I usually like doing at midway of exposure, not too exposed, not underexposed, so that the image of retina will be ideal. And the two apps that I have used is Filmic Pro and Human Indirect. I will prefer Human Indirect to Filmic Pro because Filmic Pro is more expensive. Recent apps require monthly subscription. Unlike Human Indirect, that the cost of the app now is about 1,000 naira and is specifically designed for smartphone fundoscopy by an ophthalmologist. So you can understand why I recommend that. I'm actually in discussion with him to see how we can improve the app because I discovered some issues in the app that require improvement. Like when you finish taking the videos, because I take videos, usually go to take videos so that you can now take screenshot from the videos. So after taking the video, it applies a circular mask to make the image look like it was taken by a standard fundus camera system. But in the process, it degrades the quality of the image so that the final image you get is of low quality. And we know that the quality of the camera is not necessarily tied to the pixel. It's actually tied to the optics of the sensors in the camera. And the iPhone, surprisingly, has the type of camera they call retina camera because it's not just about the megapixel, it's also about the clarity of every pixel in the picture because you can see phones with very super pixel, like 50 megapixels. But when you take the image and you zoom it, you see that it will be pixelating. And if you have that in the retina, and the retina image is pixelated, you're going to lose a lot of details. Hello, Dr. Idris, please, can you mute your mic? All right. So it's important that you understand this fact when you want to choose a mobile phone and then the app. So at the end, at the part 2, I'm going to show us how to obtain the app from the App Store. Human Direct has an Android version, which is no longer being supported, but I can share a Google Drive that you can click and download it on your Android device. It may help some people who don't have access to that. Then the editing apps, you can do that straight on your iPhone. You can also do that on the laptop. So I'm going to concentrate on this when I'm doing the demonstration. So these are the issues I've also mentioned about. I recommend Retina 2.2, which is what I've been using because it combines the magnification of plus 20D and then with the field of view of plus 28. So it's a hybrid lens. So most of the images I'm going to be showing us we're taking with Retina 2.2 with an adapter, which I'm also going to discuss in part 2. Hopefully, in part 2, we can reach a consensus on how we in Nigeria can develop our own adapter that will be affordable, that will be easy to do, and that will be deployed in every clinic because the adapter I'm using now was supplied free of charge by the manufacturer that is based in US, but they have closed up. So you cannot buy the adapter again. The free ones I have had, I've distributed it to several centers free of charge. But we need to produce our own. We need to think local. We need to also deploy local technologies and ideas. And surprisingly, when I share some of my images with our colleagues outside Nigeria, they are very amazed on how we have been able to develop this technique to this level. So this is a picture of the optics. So this is the area image if you are doing a BIO. So the area image is in between the lens and the eye. So, but when you are using the smartphone, it's the camera of the smartphone that captures the aerial image. So I'm going to skip some slides now and go to um, some of the sample images and play some videos. I have like 2 videos to play. So you can see on this picture, on the left is a tabletop fundus camera image. The cost of the camera is about $6,000. So this is the image that's produced. You could see there's a blood hemorrhage here. You can see some exudates in the macula that is a bit off center. You can also appreciate the optic disc. So this image was taken by the smartphone of this particular patient. So you can see the exudates here. You can also see the blood hemorrhage. So this gives you an idea of what you can see. So this is another image. You can see a large blood hemorrhage here. You can see a fibrous tissue that is on the optic disc, possibly maybe a remnant of the hyaloid system. You can also see on top, you can see some dots hemorrhages. You can also see some exudates and hemorrhage here and then hemorrhage here. So you can see virtually all those. You can see the hemorrhage in the macular area. You can see the exudates. You can see the large blots. You can also see in the picture just before it ends the dot hemorrhage. So these were pictures I took early on, in my journey. So you can see this image. You see in the right eye an inferior branch retinal vein occlusion. You can see the points of the arterial crossing at the occlusion happened. Then you can see the cottonwool spots. So you can make a diagnosis. Somebody can take this image and send to the ophthalmologist, and the ophthalmologist make a diagnosis. You can also see a superior hemiretinal vein occlusion. I can see in the left eye, and I can see an inferior hemiretinal vein occlusion in the left eye. So you can also image retinal tears. So this is a retinal tear that is up to 3 clock hours. So for pediatric, I have been able to take images of I've been able to use smartphone to do screening of newborns, preterms that we are screening for retinopathy of prematurity. So you could see a montage of 2 smartphone images that I brought together. I will also show us in part 2 on how to do montage. So I now drew a line. This line is the line from the center of the macula to the center of the disc. So you now have the zone 1. Then from that center of the macula, the same diameter, so we now have the zone 2. So you can see this ridge. The ridge, sorry, this is zone 1. This is twice the diameter. So this is zone 1. So from here, this is the radius, this is the diameter of zone 1. So anything outside this is zone 2. So you can see the ridge. And if you look well, you can see that it's raised. So telling you that it has already reached stage 3. And you can see the tufts here. You can see that they already entered into zone 2. And you can see evidence of tortuosity of the vessels. You're already thinking of a plus disease. So this is a typical image that you're going to get if you master the technique with a smartphone, and you can use it for documentation also. And for interpretation, like if you are in doubt, you don't know which treatment to give this patient, you can actually transmit this to a pediatric ophthalmologist for consultation. So this is another image. This was actually one of the images or two of the images that I presented in 2018. You can see the disc. This disc is appearing as if he has glaucoma. I zoomed in into the disc. You can make out the cup, and there is what they call monocular cues. Actually, see that there is a depression here, the way the vessels are. I can see a notch in here. The disc is not so straight. All right. So the rest of the retina is essentially normal. Where you have an issue is this. These two light images, you are going to be seeing it in most smartphone fundus photographs because they are images coming from the anterior and the posterior lens surface. They are Purkinje images coming from the posterior and the anterior surface of the lens. If you want to minimize the reflection that will be on this lens, you have to off the light in the room. So it has to be done in a dark room. And later we'll show us how you know that you are getting to a sharp image by distance between these Purkinje images. You can see this patient with an old superior hemiretinal vein occlusion in the right eye with neovascularization and glaucoma. So this is another eye, a quick case of choroidal neovascularization and posterior staphyloma in the left eye of a patient with pathological myopia. You can see on the right, this is a case of proliferative diabetic retinopathy. You can see it superiorly. You can also see the macular edema. So this was me in a 2018 Abuja conference when I was making a presentation. So this was the second presentation that we made in, I think it's Calabar, 2019. So we designed a head-mounted variation for smartphone-based indirect ophthalmoscopy, and we're able to get this image with this setup. So you can see, if you use this setup, you have a wider field of view. It's more than 50 degrees now. It will be approaching up to 60 degrees, 70 degrees if you use this. So these images were captured with that head-mounted ophthalmoscope. So using a smartphone, so you can see the cupping here, you can estimate it, you can see the rest of the retina, you can also do a close-up to see the macula and the fovea. So this is a more advanced one that was developed, which I believe we can also develop here in Nigeria. Aravint, work with some ophthalmologists and they developed this. So they use it for their eye cams to do indirect ophthalmoscopy so that you can just charge the phone and do the indirect or ophthalmoscopy. So I'm going to share a video now of that technique before I will now share the free technique. Then I will share a short video of the primary eye care worker that we are training to be able to capture this image. So if a primary eye care worker cannot capture the image, I believe the ophthalmologist can. So I'm just going to play it now. So just listen in.
The head-mounted binocular indirect ophthalmoscope has been an essential part of the retinal exam since its invention. By providing a large field of view in stereopsis, it allows physicians to perform comprehensive retinal examinations of their patients. Its greatest advantage is the ability to view the peripheral retina, which is inaccessible to the direct ophthalmoscope. However, the primary disadvantage of the indirect ophthalmoscope is the cost. In addition, it is also cumbersome to transport due to its weight, and it is often tethered by a power supply cord. Modifications of the instrument have been developed, such as the addition of wireless and video recording technology, but these features are even more expensive. Many ophthalmologists in the developing world do not afford an indirect ophthalmoscope, and for forego the indirect ophthalmoscopic exam. There is a need to develop a highly affordable and portable indirect ophthalmoscope. Smartphones present a possible solution to this need. We have developed an inexpensive indirect ophthalmoscope using a smartphone that functions surprisingly well. Smartphones have the unique advantages of being portable, inexpensive, and ubiquitous. The accessory we designed uses a standard headband with an attached plastic plate that securely holds both the close viewing lens and the smartphone. The plastic plate is easily 3D printable and may be customized for the type of headband and smartphone used. The smartphone's built-in flash acts as a source of illumination and makes it possible to record a video of the retina. Smartphone's wireless and portable capabilities allow us to use the technology in the field and transmit data seamlessly. The video recording additionally helps us confirm the diagnosis with an expert and can be used for teaching purposes. The device does not need an external power supply, which enables its use even in remote villages where electricity is unreliable. An app has been developed for hands-free, voice-operated video recording in order to make the device more user-friendly. The app allows physicians to start and stop video recording on voice command. Additionally, users can split the screen for binocular viewing and change various brightness and zoom settings. There is also an external Bluetooth device, which can be used to capture still images. We have field tested this device and found it useful for recording fundus exams in the clinic, in the operating room, and at screening camps in underserved villages. This device allows for recording of high-quality videos of various retinal diseases. The familiar movements in performing the indirect ophthalmoscopic exam, manipulating one head and condensing lens, are all preserved with our device. The expected cost of the device is around $30 US. This is a fraction of the cost of modern indirect ophthalmoscopes, and smartphones are already widely used by physicians. By combining a readily available technology, the smartphone, with our device, we can mimic the results of a video-equipped indirect ophthalmoscope in the field at very low cost, while creating teaching opportunities for our residents.
So because of time, I'm going to skip this video, but I'll give us a link to the video. So this is a presentation that we made in a World Ophthalmology Congress in 2020, South Africa. So you can see this image was taken by participants of the Lagos OSN, last OSN. We imaged the retina of two patients. So you can see that this patient has a fibrous band, obscuring the optic disc. You can see this space here, and the patient is having tractional retinal detachment. Then you have another patient with a suspicious disc, and you can see the optic disc. You can make out the vessels, and when you zoom in, you can see the disc, and you can actually make a diagnosis with this. So this was the OSN. So I want to appreciate Professor Adioti and all the people that were part of this, and they really had a good time. And it's my desire that all of us will learn this technique. So if you look on this side, you will see that the patient is lying down, and the doctor examining the patient is on the head. So I found that by this positioning, you get an image that is not inverted. So what you see is actually similar to what you do in direct ophthalmoscopy. So if you are looking at the right eye and you take the image, the macula will be by the left of the optic disc. The optic disc will be on the right. Same thing with on the left. So you can see the patient is using the hand as the focus. So you cancel the patient. Let me not go into the different steps because I'm going to reserve that one for part 2. This hall was illuminated and it's not supposed to be. It's actually supposed to be in a dark room. If I go back to the image, you may see, okay, there are no additional lights. Okay, all right. So this is another video, which is a free technique. So this video is a video of a free technique. So I'm just going to play it, courtesy of an ophthalmologist that is based in South America.
This is a video tutorial on how to take pictures of the retina with a smartphone. All you need is a smartphone with a camera and a 20, 28 or 30 diopter lens for indirect ophthalmoscopy. It is very useful to have these images for telemedicine to show the images to the patient, photographic follow-up of lesions, academic purposes, among others. How to take the picture. It is very important that the smartphone has a continuous LED flashlight just inside the camera. This is that the light source is coaxial with the camera. I know it works with iPhone 7, 6, and 5, but
Sorry, I wanted to pause.
This is a video tutorial on how to take pictures of the retina with a smartphone. All you need is
Sorry, let me check something.
a smartphone with a camera. This is just a phone. First, open the camera actual with the camera.
Okay.
I know it works with iPhone 7.
Okay, so that's the coaxial thing I was talking about. So this is the camera, and this is the flashlight. So you can see the LED flashlights here. And one good thing with iPhone is that you can alter the flashlight intensity of the iPhone. So it has like up to 5 steps. If you cannot alter it in your phone, there are also other ways to do that. So I'll play it.
7, 6, and 5. But in theory, any smartphone with the light source inside the camera should work. First, open the camera app in your smartphone, then switch it to video mode. This way, the flashlight is continuous. Be sure the flash is turned on. Now, zoom the camera by pinching out with 2 fingers up to 3/4 of the zoom bar. This way, I've acquired the best results. Once you have an image of the retina,
So the reason why the camera was zoomed is so that you are going to focus on the rims of the lens. It's very important. It's a very important step that most of us miss, because if you don't focus on the lens, you are going to capture so many other images, and the image of the retina you capture will be so small, and when you zoom in, it will be pixelated. But when you zoom it, don't zoom it too much, don't zoom it too little. So where you see him taking the picture, you see that the rims of the lens is on either side of the edges of the phone. So I'll just play it so that you'll see what I'm talking about.
on the screen, start recording. On top of the screen,
So
adjust
like I
brightness
said,
and exposure.
we use a video to record instead of taking pictures.
Dilated. Set your patient just as we're going to perform an indirect
So you can see the rims of the lens are on the sides, 2 sides of the phone. So you just concentrated on that lens so that the image that is formed will be captured. You can see how clear the images are. Yeah. So that's the imaginary axis I'm talking about.
Remember, always the lens centered in the screen.
You can see that the lens is centered on the screen,
Back and forward to obtain the image of the retina.
and you are fixing that distance, lens eye distance and
To keep the lens
lens phone
centered and
distance.
filling up the screen width, you should make small movements with the smartphone and avoid moving just the lens. Move both lens and smartphone in synchrony. Finally, once the video is recorded, you can pause it in the frame you want to capture and take screenshots by pressing simultaneously the home and lock buttons in the smartphone.
So these are pictures that you can actually get. You can see that you can see a lot of clarity if you get the technique right.
Here are some example images.
So these are some of the results that he has. At the end of this presentation on part 2, I'm going to share a lot of images with us, so we can see what is possible. You can see magnetic nerve fiber. You can see arterial occlusion. You can see an active toxoplasmosis. albinism in an infant, the retinal edema, normal optic disc. You can see how clear these images are, asteroid hyalosis. So you can actually image the vitreous with this technique. So, and a patient that is bedridden, that cannot even have a standard photography, can also image it. So these are laser bonds, retinal detachment, and tear. I can actually see it. This is a bullseye maculopathy. Myopic choroidal neovascularization, choroidal nevus, the hyperplasia of the retinal pigment epithelium. You can see a peripheral tear. I've imaged a lot of tears, even in the far periphery. So it's a macular hole, it's a healthy optic disc. You can see how clear these images are if you can get the technique right. So we're going to allow these things to sink in so that we can have a demonstration next time. So this is a primary healthcare worker in our hospital who is using a setup that I usually use, the iPhone on an adapter and in front of the eye. So the patient is lying down and she's at the head of the patient. So you can see that the hands are steady. I connected the phone to the screen so that I'll see what she's doing. So I came close to the phone. She has some overexposure. When you have some overexposure, the optic disc is not going to be clear. So this was still her first trials in this, but she's already getting some reasonably good image. And these things have been recorded as they have been taken. So you can now take the best image. So this primary health I just had like 1 hour training, and she started taking these images. This is the end of part 1. Because of time, I'm going to discuss safety, artificial intelligence, and then I'll go straight into the tips, and then we'll do a live demo. And then we'll talk about how to source the materials and applications, and then take more answers and questions. So, but I want to pause here for now and take a few questions since we are short for time. Thank you very much.
Thank you very much, Dr. Edoga. It's been a very interesting session. Been very fascinated by the pictures and what smartphone can do. So we'll take comments and questions. Some of us, we can put questions in the chat box. Then we'll read, and also you can raise your hand if you have questions to ask directly. We also welcome experiences of what some of us have tried this technique, what challenges we faced, and we overcame such challenges. Well, I'll start off. There's a question here on the chat box. Can we use Android? Can Android phones be used?
Yes, Android phones can be used, but they are limited from a little experience that I have. I will recommend an iPhone, but the Human Indirect, which I recommended, is also on Android. But the capacity of the Android phone is usually limited. But you can, yes, you can. But iPhones are usually best, because what I want to do is I want to show us all the factors that are involved in getting a good retinal image. So smartphone factor is a big factor. And somebody asked whether the pupil will be dilated. Yes, pupil must at least be up to 5 millimeter to 6 millimeter dilated before you can take the image of the retina. If you have medium opacity, sometimes a standard fundus camera may miss the retina because the pulse flash illumination that it uses may be scattered by the cataract, so you may not get a good image of the retina. But when you do a BIO or you do this technique, you can image the retina, you can even see the optic disc. So, but one of the drawbacks is the constant illumination, which can make some patients to, feel a little bit discomfort. So what I usually do is I do 20 seconds and I give a patient break of like 10 seconds. And then I do it. So I do like 20 seconds, 20 seconds, 20 seconds, which will come up to 1 minute instead of doing continuous 1 minute, and patients may start getting discomfort, dry eye, tearing, and the rest. Right. So this is just the first part of the presentation. I couldn't do justice, to this topic just under 1 hour. I hope that by the next time we are going to have a demonstration. Some of us can actually go and test some of the things that they have learned and come back with some questions, and then I will show us how I set up the software, how I manage the focus, how I manage the zoom, how I manage the exposure. So these are some of the factors that play a role in obtaining this image.
Thank you very much, Dr. Edoga. I'm sure really interested. Definitely have parts of it. I have just one question to ask.
Yeah.
What do I have to check? It's
Sorry, I'm not getting your question. Your line is breaking.
so
Sorry.
I said, does the smartphone
Yes.
also called through a cataract, like what you can see when you have an indirect and you're able to see through when there's cataract?
Yes. You can see through a cataract that is not dense, but when you can see something with an indirect, most of the times you can also see with a smartphone. So it uses the same principle of indirect or ophthalmoscopy. However, some other applications which I'm going to talk about, like Big Eye and DI, they use the principle of direct ophthalmoscopy. But those ones are clip on, so you clip them onto your phone, and then you take the image just like a direct or ophthalmoscopy. So, but most of the smartphone ophthalmoscopy uses the principle of indirect, and where you can see with indirect, you can also image the retina. Somebody asked model of iPhone. So what I recommend is iPhone 8, iPhone 7, 8. It's more stable, has better optics than the lower versions, and then the camera is coaxial to the flashlight, and is not expensive like you have other iPhones. You can go for the ones that have up to 128 to 256 megabytes. I'll talk more on that in the second part of this presentation. Thank you.
Thank you very much. I don't know if you have additional comments from the participants. Mr. Chairman, Dr. Bature. Okay, get them feedback. So it's been a very great session. If we don't have any questions, then we'll call off the session, and then we'll send a flyer and also notification when the part 2 is going to come up. We appreciate everyone for coming. We appreciate and recognize our very senior colleague. At some point, Professor Chimdi Chukwuka was in the meeting with us. We appreciate everyone who's taken time to be part of this wonderful discussion this morning. And we'll see us another day. Thank you very much. And thank you, Dr. Edoga, for everything.
I want to appreciate all those that attended. Thank you very much. I'm very grateful. Part 2 in 2 weeks' time. Thank you.
Thank you.
Thank you very much.